Ideally, every client's environment should be restraint-free, and it is every nurse's goal to make it as restraint-free as possible. However, clients who are at risk for injury, whether from falls, wandering, diagnostic or therapeutic procedures, or behavioral alterations, must be protected, and there is a variety of ways to keep them safe. Restraints are protective techniques or devices used to limit a client's physical activity, either because that activity might be unsafe for the client or for others, or to immobilize a body part. Physical restraints are attached to the client's body in some way, while chemical restraints are medications used to limit or control behavior. Alternatives to restraints are techniques or devices designed to either minimize disruptive behavior, distract the client from risky behavior, or monitor the client's actions in some way. Restraints restrict individual freedom, thus their use is limited to situations where the client poses a danger to self and others, or when a body part must be immobilized for a procedure. Any use of restraints for behavioral management without the provider's order is considered false imprisonment and is illegal. Regulatory agencies such as the United States Centers for Medicaid and Medicare Services and the Joint Commission on Accreditation of Healthcare Organizations have established standards for the safe and appropriate use of restraints. These standards make it clear that the reasons for the use of restraints must be documented clearly, and all less restrictive interventions must be implemented first. Safety measures the nurse must try first include checking on the client frequently, putting the bed in the lowest position, using diversion or distraction, or moving the client to a more supervised area, for example, closer to the nurse's station. Many other alternatives are being used to keep clients safe, such as replacing full side rails with half rails to keep clients from climbing over them toward the foot of the bed and falling, placing a personal item on the door of a wandering client's room to help her identify it, and using environmental restraints, such as furniture or large plants as barriers, to deter wandering clients from venturing beyond appropriate areas, provided, of course, that this does not create a fire safety hazard. Another idea that many institutions use is the concept of sitters, family members, trained volunteers, or healthcare workers who accompany clients who need continuous supervision to stay safe. A variety of products and devices have been designed for client safety without physical restraints. One example is a lightweight electronic alarm that can be positioned on a client's leg. An alarm will sound when the client begins to stand, kneel, or crawl, alerting the nursing staff that the client might be at risk for falling. Another is a bed monitor, a mat that is attached to the mattress under the sheets and will sound an alarm at the bedside and at the nurse's station when the client attempts to get out of bed. Similar devices are also available for wheelchairs and toilet seats. Another option is a soft-sided self-enclosed bed that has a vinyl top and a zippered nylon net canopy to keep the client safely inside without restricting movement. Yet another option is a low bed, a bed that keeps the client only inches from the floor, yet can be raised to the appropriate height for delivering client care. After other methods of keeping a client safe have been attempted unsuccessfully, or in an emergency situation when a client becomes combative, the nurse may have to apply physical restraints to protect the client or others. The nurse must then obtain an order from the provider to continue the restraints. Examples of physical restraints are a vest restraint, a sleeveless jacket with straps that cross the chest and pass through slits in the vest so that they can be tied to the bed frame or to the legs of a chair. A belt or strap restraint, applied over the client's gown or clothes, around the client's waist, then tied to the back of the chair or to the sides of a stretcher. A mitt, mitten, or hand restraint, a closed, thumbless covering that goes over the hand and is secured around the wrist. This type of restraint keeps the client from scratching, picking, or removing therapy devices without unnecessarily restricting limb movement. A wrist or ankle restraint, a padded strap that wraps around the wrist or ankle and is tied to the frame of the bed or chair to restrict movement of that particular limb. The nursing care plan for restraining a client must be specific and must include all legal requirements and an outline for safety and documentation. Safety measures for clients in restraints include removing or replacing the restraint frequently, padding bony prominences under or near the restraint, performing neurological and circulatory evaluations of color, sensation, temperature, mobility, and capillary refill of the area distal to the restraint at least every 2 hours, allowing enough slack on the straps of the restraint to enable the client to move both arms and both legs to do range of motion exercises. Using knots that are easily released and do not tighten when force is applied, such as a clove hitch or a half bow knot. Keeping the restraint loose enough for the nurse to fit 2 fingers between the device and the client. Never tying straps to the bedside rails. An upper body restraint must be tied to a portion of the bed that moves with the client when the bed position is altered. Explaining the need for restraints to the client and family. Evaluating the continued need for the restraints on a regular ongoing basis according to the institution's policy, and never leaving the client alone when the restraint is temporarily removed for evaluation. You'll assess a client in restraints at least every 30 minutes and remove the restraints for a complete evaluation and range of motion exercises every 2 hours. Older adults are at greater risk for falls and injuries as a result of diminished hearing, sight, reflexes, bone density, and flexibility. Using restraints with older clients to prevent injury is not without risk, however. Skin that has become fragile from the loss of adipose tissue and from poor circulation can be damaged by the friction and pressure of restraints. And struggling to be free of the restraint can cause additional injury, for example, from climbing over side rails. Very frequent evaluations and thorough documentation of findings for these clients will help you identify problems promptly. You must also help promote their dignity and self-esteem. The use of restraints is very difficult for clients to accept, so your thorough and compassionate explanation to them and to their family is essential. Remember, when you must restrain a client, your goal is that the client will be safe and free of injury without loss of dignity or violation of their client or human rights. Now let's go ahead and view a demonstration of applying a wrist restraint to an adult client. We'll assume that the nurse has checked the provider's order and has explained the procedure to the client. The only equipment the nurse needs is the actual restraint, in this case, a wrist restraint. We will assume that the nurse has checked the provider's order for the restraint and has verified the client's identity. The nurse first assesses the skin area over which the restraint will be applied, making sure it is intact and that there is adequate circulation to the extremity. Following the manufacturer's instructions for the particular restraint, the nurse then applies the padded portion of the restraint carefully around the client's wrist. She pulls the tie of the restraint through the slit in the wrist portion, making sure that she can easily insert 2 fingers between the restraint and the wrist. Using a quick release knot, she attaches the ends of the restraint to a portion of the bed frame that moves with the client. After application, she then checks the client's hand for adequate circulation. After applying a restraint, you document the behavior that indicates the need for restraint, your initial assessment, and the type of restraint you applied, along with any teaching or other nursing actions you took to support the client and the family. Remember, you must use restraints only as your institution's protocols allow, and never without a provider's order, in an unsafe manner, or without frequent observation and reassessment of your client. The purpose of the restraints is defeated if they injure the client in any way.